Welcome to M Health and Info, your ultimate source for all things health and wellness. Join us as we explore the latest in medical science, debunk health myths, and provide expert insights to empower you on your health and wellness journey. Hit subscribe, ring the bell, and let's explore the world of well-being together. This is M Health and Info, where knowledge meets vitality.
Human papillomavirus, HPV, vaccine is a crucial tool in preventing HPV infection and related diseases. HPV is the most common sexually transmitted infection worldwide, with over 100 types identified. While many HPV infections clear up on their own without causing any symptoms or health problems, some types of HPV can lead to serious conditions such as genital warts and various cancers, including cervical, vaginal, vulvar, penile, anal, and oropharyngeal cancers. The HPV vaccine works by stimulating the body's immune system to produce antibodies against the virus, providing protection against future HPV infections. There are several types of HPV vaccines available, with the most common ones targeting the most prevalent HPV strains that are associated with cancer and genital warts. Here are some key points about the HPV vaccine. 1. Prevention of HPV infections. The HPV vaccine represents a pivotal breakthrough in the realm of preventive medicine, offering a formidable defense against the insidious human papillomavirus, HPV, and its associated diseases. HPV, a ubiquitous pathogen, pervades communities worldwide, posing a significant public health challenge. While the majority of HPV infections resolve spontaneously, certain strains can wreak havoc, precipitating a spectrum of ailments ranging from benign genital warts to life-threatening cancers. By targeting the most prevalent high-risk HPV types, the vaccine harnesses the power of immunization to shield individuals from potential viral incursions, fortifying their bodies with a robust armamentarium of antibodies primed for combat. At its core, the HPV vaccine operates on the principle of prophylaxis, proactively bolstering the body's natural defenses before exposure to the virus occurs. By inoculating individuals prior to sexual debut, when susceptibility to HPV acquisition is highest, the vaccine confers a crucial advantage, erecting a formidable barrier against viral infiltration. This preemptive approach not only averts the establishment of persistent infections but also curtails the transmission dynamics, interrupting the viral life cycle at its inception and curbing the cascade of downstream sequelae. Furthermore, the HPV vaccine embodies a paradigm shift in disease prevention, transcending traditional notions of treatment-focused interventions to embrace a proactive stance centered on primary prevention. By preemptively neutralizing the viral threat, the vaccine obviates the need for downstream therapeutic interventions, sparing individuals the anguish and burden associated with HPV-related diseases. This preventive ethos underscores the pivotal role of vaccination in mitigating the burgeoning global burden of HPV-associated morbidity and mortality. 2. Recommended age for vaccination. The timing of HPV vaccination represents a critical determinant of its efficacy, underscoring the importance of strategic intervention during key developmental junctures. Adolescence heralds a pivotal phase characterized by burgeoning autonomy and nascent sexual exploration, rendering it a propitious window of opportunity for vaccination. By targeting individuals between the ages of 9 and 26, the vaccine capitalizes on this developmental nexus, offering a preemptive shield against HPV infections before the onset of sexual activity and potential exposure to the virus. Early initiation of vaccination confers manifold benefits, capitalizing on the immunological priming afforded by youth to elicit robust and durable immune responses. As the burgeoning immune system mounts a vigorous defense in response to vaccination, it lays the foundation for long-term protection against HPV-related diseases, fortifying the body's defenses against viral incursions. Moreover, by inoculating individuals at a younger age, the vaccine engenders a broader societal impact, curtailing the transmission dynamics and impeding the propagation of HPV within communities. Furthermore, the recommended age for vaccination reflects a judicious balance between immunological efficacy and pragmatic considerations of sexual debut. While the ideal scenario entails vaccinating individuals prior to sexual initiation, the vaccine's efficacy persists even among those with pre-existing sexual history, underscoring its utility across a broad spectrum of age groups. Thus, while early initiation of vaccination affords maximal benefit, older individuals stand to gain substantially from timely intervention, mitigating their risk of HPV-related diseases and averting potential downstream sequelae. 3. Dosage and administration. The administration protocol of the HPV vaccine is meticulously crafted to optimize immunological priming and foster durable protection against HPV infections. Central to this regimen is the concept of priming the immune system through a series of carefully timed inoculations, harnessing the power of sequential dosing to orchestrate a coordinated immune response. By administering the vaccine as a series of shots over a predefined timeframe, healthcare providers endeavor to capitalize on the immunological memory conferred by each successive dose, bolstering the body's defenses against HPV incursions. The dosing schedule typically varies depending on the specific vaccine product and the age at which the vaccination series is initiated. For instance, some HPV vaccines require 2 doses spaced several months apart for individuals under the age of 15, while older individuals or those with certain medical conditions may necessitate 3 doses to achieve optimal protection. This tailored approach reflects a nuanced understanding of immunological kinetics, calibrating the dosing regimen to maximize vaccine efficacy across diverse demographic cohorts. Moreover, the dosing and administration protocol of the HPV vaccine is underpinned by a commitment to accessibility and equity, ensuring that individuals from all walks of life can avail themselves of this life-saving intervention. Efforts to streamline vaccine delivery mechanisms, enhance provider education, and expand access to marginalized communities are integral components of this endeavor, fostering a culture of inclusivity and empowerment. Furthermore, the administration of the HPV vaccine transcends the confines of clinical settings, encompassing a multifaceted approach that spans community outreach initiatives, school-based vaccination programs, and public health campaigns. By harnessing the collective efforts of stakeholders across the healthcare continuum, policymakers endeavor to maximize vaccine uptake and realize the full potential of HPV vaccination as a cornerstone of disease prevention. 4. Effectiveness. The effectiveness of the HPV vaccine stands as a testament to the transformative power of vaccination in averting the scourge of HPV-related diseases and fostering a healthier future for generations to come. Extensive clinical trials have unequivocally demonstrated the vaccine's capacity to confer robust and durable protection against HPV infections, paving the way for a paradigm shift in disease prevention strategies. Central to the vaccine's effectiveness is its ability to harness the body's innate immune defenses to mount a targeted response against HPV antigens. By priming the immune system with a cocktail of viral proteins, the vaccine imbues the body with a cadre of specialized antibodies poised to neutralize viral incursions and thwart the establishment of persistent infections. This immunological fortification not only prevents the onset of HPV-related diseases but also curtails the transmission dynamics, interrupting the viral life cycle at its inception and curbing the cascade of downstream sequelae. Moreover, real-world data corroborate the vaccine's efficacy in diverse population cohorts, underscoring its utility across a broad spectrum of age groups, ethnicities, and geographic regions. Observational studies have documented a precipitous decline in HPV infection rates, genital warts, and precancerous lesions among vaccinated individuals compared to their unvaccinated counterparts, attesting to the vaccine's tangible impact on public health outcomes. Furthermore, the effectiveness of the HPV vaccine extends beyond individual protection to encompass broader societal benefits, including herd immunity and downstream healthcare cost savings. By achieving high vaccine coverage rates, communities can effectively shield vulnerable populations from HPV infections, thereby conferring indirect protection to those who may not be vaccinated. Additionally, the prevention of HPV-related diseases translates into substantial economic savings, stemming from reduced healthcare expenditures associated with the diagnosis and treatment of cervical cancer and other HPV-related malignancies. 5. Safety. The safety profile of the HPV vaccine stands as a cornerstone of its public health utility, underpinning widespread confidence in its use as a vital tool in the arsenal against HPV-related diseases. Extensive clinical trials, post-marketing surveillance efforts, and real-world data analyses have collectively reaffirmed the vaccine's exemplary safety record, providing reassurance to healthcare providers, policymakers, and the general public alike. Central to the vaccine's impeccable safety profile is its meticulous formulation, which undergoes rigorous scrutiny to ensure purity, potency, and absence of contaminants. Each vaccine batch is subjected to stringent quality control measures, encompassing comprehensive laboratory analyses and clinical evaluations, to ascertain compliance with exacting regulatory standards. This commitment to product integrity underscores the paramount importance placed on patient safety and underscores the vaccine's status as a gold standard in preventive medicine. Furthermore, the safety of the HPV vaccine is corroborated by a wealth of empirical evidence gleaned from real-world vaccine deployment initiatives. Large-scale population-based studies, systematic reviews, and pharmacovigilance databases consistently report low rates of adverse events following HPV vaccination, with the vast majority being mild and transient in nature. Common side effects, such as pain at the injection site, mild fever, or transient dizziness, typically resolve spontaneously within a few days and pose minimal clinical significance. Moreover, thorough investigations into purported vaccine-related adverse events have consistently failed to establish causal links between HPV vaccination and serious health outcomes. Robust epidemiological analyses, expert panel reviews, and regulatory assessments have consistently affirmed the vaccine's favorable risk-benefit profile, debunking unfounded claims of purported vaccine-related harms. This steadfast commitment to evidence-based medicine serves as a bulwark against misinformation and instills confidence in the vaccine's safety among healthcare providers and the general public. 6. Impact on public health. The HPV vaccine's transformative impact on public health is a testament to the profound dividends yielded by strategic investments in preventive medicine. By harnessing the power of vaccination to thwart the scourge of HPV-related diseases, this pioneering intervention has emerged as a linchpin of global health initiatives, charting a course towards a future characterized by reduced morbidity, mortality, and healthcare disparities. At its core, the vaccine's public health impact is predicated on its ability to avert a wide spectrum of HPV-related diseases, ranging from benign genital warts to life-threatening malignancies. Through its prophylactic prowess, the vaccine empowers individuals to safeguard their health and well-being, shielding them from the physical, emotional, and financial toll exacted by HPV infections and their downstream sequelae. By curtailing the incidence of HPV-related diseases, the vaccine not only spares individuals the anguish of preventable illness but also alleviates the burden placed on healthcare systems worldwide. Furthermore, the HPV vaccine's ripple effects extend beyond individual protection to encompass broader societal benefits, including herd immunity and healthcare cost savings. By achieving high vaccine coverage rates, communities can effectively impede the transmission dynamics of HPV, thereby conferring indirect protection to vulnerable populations, including those who may not be vaccinated. Additionally, the prevention of HPV-related diseases translates into substantial economic savings, stemming from reduced healthcare expenditures associated with the diagnosis, treatment, and management of cervical cancer and other HPV-associated malignancies. Moreover, the HPV vaccine serves as a catalyst for health equity, fostering a more inclusive and resilient healthcare ecosystem. Efforts to enhance vaccine access, promote equitable vaccine distribution, and address structural barriers to healthcare have the potential to narrow disparities in HPV vaccine uptake and mitigate health inequities among underserved populations. By prioritizing vulnerable communities and marginalized populations, policymakers can amplify the vaccine's public health impact and realize its full potential as a catalyst for social change. 7. Continued monitoring and research. The journey of the HPV vaccine is an ongoing saga of scientific inquiry and public health vigilance, underscored by a steadfast commitment to continuous monitoring and research. As a cornerstone of disease prevention, the HPV vaccine is subject to rigorous scrutiny, with ongoing surveillance efforts aimed at elucidating its long-term safety, efficacy, and real-world impact on HPV-related diseases. Central to these endeavors is the systematic collection and analysis of epidemiological data, which serves as a barometer of the vaccine's performance in diverse population cohorts. Surveillance programs, pharmacovigilance networks, and post-marketing studies play a pivotal role in identifying potential adverse events, elucidating temporal trends in vaccine uptake, and monitoring changes in HPV infection rates over time. By harnessing the power of big data and advanced analytics, researchers can discern subtle patterns and correlations, informing evidence-based policy decisions and optimizing vaccine deployment strategies. Moreover, the HPV vaccine's journey is punctuated by a constellation of clinical trials and translational research initiatives, aimed at unraveling the intricacies of HPV pathogenesis, refining vaccine formulations, and exploring novel avenues for disease prevention. Cutting-edge technologies, such as next-generation sequencing and structural biology, offer unprecedented insights into the molecular underpinnings of HPV infections, paving the way for the development of next-generation vaccines with enhanced immunogenicity and broader strain coverage. Furthermore, the HPV vaccine's trajectory is shaped by a dynamic interplay between science, policy, and public perception, highlighting the importance of effective communication and stakeholder engagement. Transparent dissemination of scientific findings, proactive risk communication, and community outreach initiatives are integral components of this endeavor, fostering a culture of trust, transparency, and accountability in vaccine deployment efforts. By fostering an open dialogue between scientists, policymakers, healthcare providers, and the general public, stakeholders can collectively navigate the complex terrain of HPV vaccination and realize its full potential as a cornerstone of disease prevention. In essence, the HPV vaccine's journey embodies a testament to the transformative power of science and public health in the quest for a healthier, more resilient future. Through its steadfast commitment to continuous monitoring and research, the vaccine stands as a beacon of hope in the global fight against HPV-related diseases, offering a blueprint for evidence-based policy decisions and collective action in the pursuit of health equity and social justice. By embracing the spirit of discovery and collaboration, stakeholders can chart a course towards a future characterized by reduced morbidity, mortality, and healthcare disparities, grounded in the principles of science, solidarity, and shared humanity.